So we are going to discuss about the echinocandins, echinocandin class of antifungal agents. First, we'll talk about the pharmacology and mechanism of action. So structurally, echinocandins are cyclic lipopeptides. The medications on the echinocandins include caspofungin, micafungin, and anidulafungin. These medications have low oral bioavailability and also they have high molecular weight. For these reasons, these medications are not available as oral preparations. These medications are available only as IV preparations. Right? They act by inhibiting the synthesis of glucans in their cell wall. If you remember, glucans are important component of fungal cell wall. There are two types of glucans: beta-1,3-D glucans, beta-1,3-16-D glucans, beta-1,3 and beta-1,6-D glucans. Right? Echinocandins inhibit the enzyme beta-1,3-D glucan synthase enzyme responsible for synthesis of beta-1,3-D glucans. Right? So echinocandins inhibit this enzyme and there will be less beta-1,3-D glucans. Right? That affect the integrity of the cell wall, affecting the cell viability. That is how they cause death of fungal cells. So what are the clinical indications for echinocandins? They are predominantly used in invasive candidiasis. That is their major use, invasive candidiasis. The drug is also effective as echinocandins are also effective in aspergillosis. Right? But there are some fungi that have less beta-1,3-D glucans in the cell wall. These fungi are usually resistant to these medications. So what are these fungi with less beta-1,3-D glucans in their cell walls? They include the Cryptococcus species that produce Cryptococcus meningitis, Rhizopus species and mucus species that produces zygomycosis or mucormycosis, and Fusarium species. Right? So we should not use echinocandins to treat infections by these fungi. Echinocandins don't have significant side effects, but anidulafungin can induce histamine secretion. So that is why it can result in histamine-mediated side effects such as pruritus, urticaria, flushing, dyspnea, and hypotension. Right? But these side effects can be minimized by slowing the infusion rate of anidulafungin. Right? That's all about echinocandins. If you have any questions, please post them in the comment section below. And also please be sure to like this video and subscribe to my channel for future lectures. Thank you so much.